Welcome to this short video where I will demonstrate how to bond engagers or attachments to the teeth. In this video I will show you how to bond attachments or engagers to a composite model. Since it is a composite model, it doesn't make sense to pre-etch the surfaces, so I will leave out the etch tint. I'll be using a template. In this case, it's a ClickRect template. It could be a template from SureSmile, Spark, or Invisalign as well, but in this case, it is a ClickRect template that I'll be using. Here I'm using the Clearfill bonding agent and a Clearfill flowable composite. You don't have to go out and buy some specific new bonding agent. Just use the bonding agent you're used to. Usually I would sandblast the surfaces where I had to bond in engagers or attachments first. Then I would etch the enamel for at least 30 seconds. First, we add a little bit of the bonding agent. And here we need to look at where the engagers are going to be sitting. I simply add the bonding agent to the teeth where I will be bonding the attachments. So next I'll simply just light cure the composite, and I don't have to cure for more than about a couple of seconds. We simply find the indentations and we fill in the flowable. If you want to use a regular composite, you can do that as well. You don't need to use a flowable. In this case, I really like the Clearfill because it has this anti-drip system, which allows you to add the composite as soon as you let go of the handle. It stops applying the flowable composite. In addition to having enough composite, we need to make sure that we don't have too much. Now, as you can see, it is rather easy for me to see where the composite is placed here in the template. That's due to the black background here. So that's one of my tips today. If you compare to a white background, which would be the background we usually have in the dental office, you can see it's considerably harder to see where the composite is actually being placed. If you have the black background, it's a lot easier to see exactly where the composite is. Once you have the template filled with the composite, you simply put the template on top of the teeth. Make sure the template is seated completely. I always press down on the template while I cure the attachment. 5 seconds should be enough. Some even say 3. I would say it depends on the intensity of the lamp. Once the attachments or the engagers have been cured, I simply go below the template and I detach the template here. And you can see here, maybe you can see it, here the template is actually breaking, and it's perfectly fine, it doesn't matter. Now the template has been used as it's supposed to. And once the attachments have been loosened, you can simply go in the most posterior part and simply just take off the template. Now here you can see how the attachments or the engagers are bonded to the surfaces of the teeth. During the removal of the template, I broke the template. It happens once in a while and it doesn't really matter. Once the template has been used, you don't have to use it for anything else. Now you go in with your regular aligner and you place that instead. If you have a patient producing a lot of saliva, or a patient where you need to bond in a lot of attachments or engagers, you can simply just cut the template in two and just bond in one side after the other. Some composite materials bond directly to the template material. It depends on the aligner system and the composite being used, but sometimes we see a chemical reaction between the template material and the actual composite. There are those practitioners who state that you should apply a little bit of Vaseline or glycerin. If you have a material that bonds directly to the template material, I would encourage you to just try a different type of composite instead of applying glycerin or Vaseline to your template. If you apply glycerin or Vaseline, stuff like that, even if it is with a small brush like this, it will change the shape of the engager or the attachment, which will then lead to a potential loss of effectiveness of the attachment or the engager that you bond in.